Good morning. So, I'm talking about managing our main homework activities, and this is giving introduction about screening and management methodology. Then, Robert talking about the disability and optimism about the small baby in their management. So, let's start the learning how to screen our baby. So, let's see one of these cases. This case is a 31 gestation and sexual challenges. Should we screen this baby? When should we screen this baby? So, the national guidance says that if you screen this baby with 15 gram birth rate or 50 weeks, higher, the believes that these babies are highest level of hospital. You can see this data in 31 weeks BCA or 4 weeks is later. However, the next stage is completely different because we have very small babies developing aggressive superiority as well as very large babies also coming because of poor nursing practices in the system. So, possible modification of the screening guidelines has been suggested that we take it to 34-week gestation as well. And we can screen as early as 3 weeks also, pick up cases of early excessive superiority. However, if we follow 30-day rule that once screening should be done at 30 days, we will be able to cover a large number of babies and there is no need to examine the first 2 weeks of life because RP is not disease and drugs. We should continue to screen at the neonatal ICU and where it is important all the RP activities, monitor the system status of the babies, and give any emergency which are needed when we do the screening. So we are all aware of the zones, zone 1, zone 2, zone 3. Zone 1 is as small as zone and this is typically where the most severe disease comes. Zone 2 is the most common area that we get to notice RP. We are also aware of the stages of RP. Stage 1 is demarcation line, stage 2 is demarcation ridge, stage 3 is extraretinal convulsive proliferation, stage 4 is subpolarity, and stage 5 is polarity. We also need to know about plus disease. There is a standard for a published photograph which shows that the penalty for osteoporosis and osteoporosis, and this signifies the activity of the RP disease. Let's see a few more cases. This case comes to at 32 weeks, also around 36 weeks. Notice that in zone 2 there is a stage 2 on this side. So we will treat this side. So if we follow up these babies, we will find that most of them will regress and we will notice that there is no age now there at 40 weeks. So the RP has spontaneous regress. The lesson that we want to learn is that all RP cases do not be treated and RP can spontaneous regress in many of these cases itself. But close follow-up is essential close treatment for that. Let's see one of these patients who came to us. It says that RP is not possible in undilated people. Then they say that RP should be done at 1 week. So if the pupil is not dilating, what we need to understand is when we run an RP program, pupil is not dilating, possibly the baby has plus disease. So you need to sit the same day and dilate the pupil and show that pupil is dilating. If the pupil is not dilated, then you need to look behind the small pupil itself because you might be having plus disease and that is what is not causing the pupil to dilate. They should know the reasons for people not to dilate in the fetal child. So if you look behind something, you see like this and you see all of these dilated aneurysms are there. Tuberculosis lentis is a normal finding in preterm babies. So somehow, if you see the aneurysms which are there, then you should really suspect that you have a severe plus disease or a disease of your RP sitting behind it. Let's see how these cases were referred. This has no stage of RP seen and they have noticed dilated dorsal vessels in both the eyes and then they derive only follow-up after 2 weeks. So the problem here is that for an experienced person, when you see dilated dorsal vessels and no stage of RP seen, the probability of dealing with the case of aggressive posterior RP where stage is actually not done there, but the plus disease is there. So possibly you need to see these babies and treat these babies. This is just to show you an introduction of APRP. APRP typically looks like this, where you have the junction, you don't see in stage 2, 3, no demarcation line, no demarcation ridge. But what you notice is that the plus disease, that is the dilation of posterior vessels, is out of proportion to the severity you see at the junction. If you have closer look at the bottom right photo, you will appreciate that there are irregular areas behind the loop as well. The color of this part matches the color of this part, and these are all irregular areas. So all this suspect plus disease, the whole dilated pupil. The pupil dilates whole today, it will not dilate at all after 1 week. So you have to examine the babies the same day and always have high suspicion of APRP. So let's learn how to treat these babies. So let's say this guy comes to you and he has all these problems and should we treat this baby? You notice that he's got a stage 3 happening here and external kind of conversations happening here. So these are the only treatment RP guidelines which are there and typically you need to divide it into type 2 RP. Type 1 RP what you need to treat. Type 1 RP is zone 1 stage plus, zone 1 stage 3 without plus and zone 2 stage 2 to 3 with plus. This is typically the current guidelines for treating RP. This chart Dr. Dogra likes to show us and basically it's a good chart which shows that zone 1 is you need to treat most of these babies and zone 3 you need stage 2 to 3 plus disease. So you should treat both eyes as one sitting because these children usually tend to get sick before the procedure, after the procedure, and not give you a time to laser again. So you should laser both eyes in one sitting. You have to laser anterior to the ridge, and not on the ridge or behind the ridge. And you intend for better view and slipped areas. This will be how post-laser will look like. You have all these laser marks are there, and you will the ridge on ridge plus disease and disease. So how does it change in the case of APRP? This is showing you again that these vessels are there for you. It is very quiet. Motion looks very quiet. But you see that direction of those two vessels is there. Says to plus disease. So I'm just showing you this to show you where is the demarcation line. You can't exactly see the demarcation line, but if you look close at geography of the same thing, you'll appreciate that these are all industrial areas, the black areas are all industrial. The blue line is actually where newcomers might think that the junction is, and they would mind to laser. But actually the area is much behind where the ridge might be appearing. So all this area between the red and white, blue, you will have to laser if you want this disease to go on because there's no one disease that you have there. So you need to be aware that the vascular is extended straight to the false junction formed by the vascular roots, and you need to recognize all the vascular areas and then laser them. So sometimes, let's see this case is there, laser regressed RP, pretty fine and not easy to worry, but at 4 weeks, suddenly this PRP started happening. So what went wrong? Laser is proper insight. So if you see carefully, the vessels actually finished here and the laser was actually completed inside. So you need to go ahead and laser further than what you were doing. So in a case to see here, so see when laser, what seems to be wrong here? So if you look at carefully the ridges here and the state is actually completely laser. So you need to open the laser here if you want the disease to actually go away. So you need to have a closer look at the junction, and surprise is not uncommon, so you need to follow this till the complete disease regression occurs. Let's say in the case, typically this is you see in some of the babies where you come to you, typically come with squint or they come with a deep vision, things like that. You look behind, you see the child is feet down on. So typically bigger babies come with this kind of picture and you need to see what goes wrong. So you should always examine the periphery of these babies, and if you come to the periphery, you might see areas like this. These are all sequelae ROP, zone 20, zone 3. You might have some fractal areas that now regress spontaneously and has sequelae and some fractal areas, which is called a disc macular band, and that might really equal this. So you should always examine the periphery for ROP sequelae. Even bigger babies who come to you will never be lasered or never be treated for ROP if they are freedom and having some optimal vision and squint, so we can be looking for this. So just a few cases how not to treat. This is, if you see this baby here, this baby came to us, the baby was not going away, the plus disease was not going away. Some kind of laser was done here, but this laser was not incomplete. So the idea is to laser all this part anterior to the ridge. You don't laser it, the stimulus will not go away, and the ROP will continue to progress. So basically, this is you need to augment all this. You need to do it. In the case, how not to laser? There's no sense lasering behind the ridge. You need to laser anterior to the ridge. From the ischemic area, the stimulus is all anterior to the ridge. Lasering behind will not help in this case. This was the type of a doctor who came to us. He was just asking us to try to blind, he's not seeing, not following light. And we looked behind his eye, and he had the ridge was here. Some remnants of the ridge are here, and it was a zone 2 anterior disease. And you see some kind of PRP has been attempted in this case, and the lasers are anterior to the ridge as well as posterior to the ridge. In fact, so posterior to the ridge that they have gone ahead and lasers the phobia as well. So we know this child versus not because of ROP, but because of other reasons itself. So we don't want to do all these things, and the correct and complete treatment is absolutely necessary if you want to make ROP go away. Otherwise, we need to advance ROP in blindness and obviously medical healing cases. Thank you.